was made. And reflected the dura to medial side. And we started to remove of the part of superior frontal gyrus, partial SFG removal. The craniotomy size was about 3 to 4 centimeters, and we can identify the singlet sulcus at the bottom of the resection cavity. And also we could identify the pericardial arteries and the surface of the corpus callosum. Next, we remove the white matter and open the lateral ventricle. And then we identify the foramen of Monro and widen the space for the projection fiber disconnection. And next, we started to anterior colostomy with a via lateral ventricle route. We follow the pericardial arteries retrogradely and go to the frontal base. And we can see interhemispheric fissure. And at the bottom of the frontal base, we could identify the olfactory nerve running in the basal part of the frontal lobe. And then we switch to the surgical view to the posteriorly and started to perform a posterior colostomy. And follow the posterior, pericardial artery antegrade posteriorly. And then we perform a perisplenium part removal. And then we identify the fornix at this point, the atrium of the lateral ventricle. And then we started to perform ceramic isolation. I mean, cutting the lateral border of the thalamus, following the choroidal plexus. And go forward to the inferior horn of lateral ventricle. And we reached the inferior horn lateral ventricle and confirmed the hippocampus. And then we switch the surgical point to the frontal base and go posteriorly. And we can see mesocerebral artery beyond the arachnoid and go beyond the cerebral fissure. And lastly, we perform a major temporal lobe disconnection. At that part, anterior choroidal artery is a good marker to complete the major temporal lobe disconnection. This is a final view of the microscope.